Good afternoon, everybody, and thank you for joining us for our 7th community conversation. My name's Alex, and I'm the Programmes Officer at Northamptonshire Community Foundation and Staff Champion for the United Nations Sustainable Development Goal 10, Reduced Inequalities. So by 2030, the UN aims to empower and promote the social, economic and political inclusion of all, irrespective of age, sex, disability, race, ethnicity, origin, religion, economic or other status, and looks to ensure that no one is left behind. I chose to champion UN SDG 10 as I want to live in a fairer and more equitable society. And we still have a long way to go, as you can be seen in the recent report curated by the Runnymede Trust. As a community foundation, NCF has always strived to fund organisations which support disadvantaged communities. And a recent example of that is the My Lockdown project by Caring and Sharing Trust, which will be exhibiting the art, photography and poetry created by people with learning disabilities and their families and carers who have been shielding during COVID-19. NCF has recently launched the Constance Endowment Fund Global Goals, which will enable community organisations across Northamptonshire to think global and act local. This rolling programme offers grants of up to £3,000 to organisations working to achieve the UN SDGs of no poverty, zero hunger, good health and wellbeing, quality education and gender equality. As our community conversations continue throughout the year, more goals will be added to that list. And these conversations are a way of bringing together donors and community organisations who are working to reach the Sustainable Development Goals. And today, our guest panel includes Pratima Dattani from Support Northamptonshire and recently formed local infrastructure organisation, Northamptonshire Black Communities Together. Graham Wilson from Northamptonshire Sport and representative of Northamptonshire Federation of Disability Sports, and Will from QSpace. Thank you to our panel for joining us today, and I'm now going to pass over to our Grants Director and Deputy CEO, Rachel Mcgrath.
Thank you, Alex, for that introduction. And Alex is our Reduced Inequalities champion, also partnered and twinned with one of our trustees, Peter Borley-Cox, and also one of our grants advisors, Marcia Walker. So we're going to kick off with a conversation between myself, Graham, Pratima and Will. We know that reduced inequalities is a very, very broad area and has intersectionality across a number of the goals. So this is just a starting point for us, and we will continue on this journey to continue this conversation across a broader range of areas to reduce inequalities. But we're really delighted that as experts and professionals in your field, you've taken the time to join us today. So without much further ado, just to get a little bit of background introduction, understanding about where you're coming from, what local activities or commitments are you carrying out to help reduce inequalities locally? And this could be in your role as a donor, part of a giving circle, as a local charity professional, or even in a personal capacity. And let's start with Will first. Over to you, Will.
Hi everyone, I'm Will from QSpace. My pronouns are he and him. So QSpace are really committed as an LGBT organisation to sort of helping to reduce inequalities. Things have been really difficult over the last year, but we've still been trying to keep things working and keep things going. Some of the things what we do is we run an LGBT youth support group. This is just a place where LGBT young people can come and drop in and just be themselves. There's nothing magical or special about it as a youth group. It's a youth group and we do crafts and cooking and play silly games and talks and workshops. It's just the fact what the young people are all LGBT. So those conversations, what they might not be able to have with their peers, whether it be about gender or sexuality, they know what they're not going to be judged or made to feel different or awkward. They can use whatever name they want. They can talk about the pop star or the person on the telly, little things what we all take for granted. But if you're LGBT, those things can sometimes be really difficult. As an organisation, we really believe what things have to be good for everybody. So anything what we ever put on, we always try and make it as accessible as possible by only renting or using buildings which are fully accessible to everybody. And we always try and make things as affordable as possible. So like holding things where it's possible to get there by bus, and anything we do, we try and do for free or as a minimum charge as possible. As an organisation, we have in the past, and we hope to reopen soon, some like adult support services as well. They've been more difficult to keep going over the lockdowns. But we do offer training because we believe by training everybody's more aware of LGBT issues and therefore is better able to help support the community. So that training goes across like workplaces, the police, NHS, schools, colleges, sort of anywhere really where if you're LGBT and you come into contact with another organisation, then we like to be able to offer training for those organisations so they can better support our community.
Thank you, Will. Thank you for that insight into Q-Space and the wonderful work you've been doing, particularly, I imagine, during the pandemic to provide a safety net for young LGBT young people. I particularly like the comment, good for everybody, and highlighting that issue that a lot of people don't think about in terms of accessibility, which is obviously a key issue in reduced inequalities, and for highlighting the training that you offer to the wider community too. Over to Pratima.
Thanks, Rachel, and thanks for the invitation. Good to share the space with Q-Space and Northamptonshire Sports as well. As you said, Rachel, inequality reduction is a big agenda really for us, I think, in Northamptonshire. And it's really important, as you're trying to do, is to address things locally so that there's kind of wider global impact. So our kind of response, both as Support Northamptonshire and the work we're doing with Northamptonshire Black communities together, is a direct response that we're making as Black communities to addressing inequalities in Northamptonshire. And a lot of historical inequalities have got highlighted as a result of COVID. So not that those inequalities didn't exist, but actually they've been many times magnified through the COVID period. So in a sense, we've come together as Black organizations since December. We launched in the last 2 months NBCT as an infrastructure organization for the county for Black communities. And our response in doing that has come out of actual need that everybody's expressed. So it's not a whim of a development, it's actually Black organizations and Black communities saying enough is enough, we need to do something and take some control over this. A lot of Black organizations made very significant responses over the COVID period and actually did it in isolation to anything else that existed. NCF were great at funding many of those organizations, but actually everybody had to come at it individually, the pressure of kind of getting funding, the pressure of delivering, and we all recognize that the value of collaboration was really important. Not only that in terms of our need as kind of Black organizations, but also that there were structural inequalities that we needed to tackle. And that can be only done when we come together and have a collective voice. So our response in developing NBCT is to both create core infrastructure for Black organizations so that they can be supported to deliver appropriate services to Black communities, but also to then create specific and equal provision for Black communities. We've actually found that through our response through COVID, which has been incredibly incredible levels of provision at a very high level of volunteering, we've actually found the most vulnerable people in our communities who happen to be from Black communities. And we would not have found them out had we not provided food provision, access to poverty reduction, etc. So our model is to have infrastructure, but also create specific services. And we then want not just a dialogue with the public sector and the wider voluntary sector, but actual joint action with all of them as well. So just picking out from what you've said around the precedent of the UN, talking about the furthest behind need to be the main focus for policy action. We want to influence long-term policy change and social action so that it addresses inequalities for Black communities in Northamptonshire.
Thank you, Pratima. I think what you've highlighted is really laid bare the inequalities that exist in our society, and particularly when we think about how Black and Asian communities were disproportionately impacted by the pandemic. And it's really great to hear about the strategic and crisis response that you're talking about, not just about the bespoke services to reach out to the most vulnerable communities and residents within our county of Northamptonshire, but also the importance of meaningful collaboration and partnership. So not tokenistic gestures, real policy change, so that everyone within our community, and especially our Black communities where there are historical inequalities that are still unaddressed, that policy change can make a real shift in difference to them, in the words of Will, ensuring that we have services that are good for everybody. Thank you. Over to Graham. Graham, welcome.
Thanks, Rachel, and thanks for having us, and well done to Will and Jordan for their answer there. From my perspective, obviously, working with disabled people, Northamptonshire Federation of Disability Sport and Northamptonshire Sport, our work is ongoing, really, to try and get disabled people more active. Unfortunately, they're half as likely to be so as the rest of the population, so we're keen to try and reduce that inequality. And it's just frustrating from our point of view that just prior to the pandemic, for the first time in a good while, that gap was being closed. Starting to see disabled people getting more and more active. And then obviously the pandemic has now knocked that back over, and now the gap is bigger than ever before. So from our perspective, the work that's gone on is that in collaboration with the Community Foundation, obviously you kindly hold a pot of funding on our behalf, which any local group and organisation can apply for projects that can help disabled people get more active. And we've really tried to reduce a lot of the barriers that some funds have in place in terms of what can be applied for. So whether that's capital costs or running costs or establishing new things, we don't really care as long as the outcome is getting disabled people in the county more active. So I think that's the first thing that we've obviously got in place, working with partnership yourselves. And then through our regular everyday work, we come together every sort of few months. Northamptonshire Federation of Disability Sport has a hardcore group of mixture of other people like ourselves in the sport and physical activity sector, obviously working to provide the opportunities out there, but then collaborating with people who support disabled people as well. So whether that's healthcare professionals, whether it's parents and carers, whether it's daycare providers, anybody that has some sort of work linked to supporting disabled people, and basically bringing these two groups together, we have a way of making sure people are aware of what's available to them in the community already, developing new things together, again in collaboration, and then really highlighting what the current barriers are, and working together to see how we can reduce those in the future.
Thank you, Graham, and for highlighting the barriers to accessing physical activity and sports activity that other people across the ability spectrum may take for granted, and the work that you're doing to redress that balance through Northamptonshire Sport, but also through the Northamptonshire Federation of Disability Sport, of who we hold a fund on your behalf to help support that access. And then again, that term collaboration coming up, about the need not to work in isolation, but to collaborate and partner with other organisations in order to really tackle and reduce inequalities. So thank you all for those introductions, and that was just to warm us up. So we move over to our first question, and if you've watched the community conversations previously, you may have an idea of the format. And you have been, we're not springing any surprises on you, but we have sent the questions in advance. So without much further ado, former President of the United Nations Economic and Social Council, Ojun, has stated, addressing inequality is a moral imperative. To leave no one behind, those furthest behind must be the main focus of policy action. And to achieve this objective, inclusive institutions have to be built at all levels in order to give a voice to those in greatest need and ensure that commitments are made and kept. So with that in mind, from your perspective and your work, what further resources and what local solutions would you like to see being funded? And are there any specific immediate needs you think are an urgent priority for this global goal? And over to you first, Will. Will, you're on mute.
That's a really good question. I think to start with, the pandemic has taught us loads about what accessibility really means, in terms of meeting on Zoom means what you can do it from your home. Like if for whatever reason you can't get out and about to make it to places, you're still included. The fact what we can turn on subtitles when we're in a meeting, so we can understand better if hearing isn't as great as other people. We've learned to do all these things, but now we're starting to come out to a time where everyone's looking forward to meeting in person. Like we feel it's really important what those people aren't left behind. When we start meeting in person, is there a way what we can continue to mix things, or even do events which are dual and has an online element, but also an in-person element, meaning again, what like everybody gets the chance if they want to join in, there's a way what they can join in. Sort of QSpace have realized what we often meet in fixed locations, and that can be really good because everyone knows where to go to come and find you. But that's not great depending where you live. So like most things rely on people having cars or access to transport. And the LGBT community has grown sort of from the town centre, and then it's kind of grown north. And there's some services for adults and young people sort of in sort of Wellingborough and Kettering and Corby, but nothing happens in the south of the county. So if you're LGBT and you live south of Northampton within the county, then there is no support no matter what your age. So for QSpace, we're looking at actually, well, what do we need to fund and where do we need to fund things? And is that about like tackling discrimination directly within organizations, or is that about setting up more support networks? We don't want to have the answers. We believe really what communities should lead communities. So as an LGBT organization, most of our core team are members of the LGBT community, but we also want to hear from people. So over the summer months, we'll be putting out surveys and doing some review work to say, well, what should we be doing? Where should our targets be for the next 6 months and the next 2 years? And really looking at what the community feel we should be doing and where we feel we should be doing it. And then sort of going from there, really. I think things that are community-led really speak back into the communities. So for us, that's like such a priority, what like the little local groups get the funding they need to survive and to thrive and to develop.
Thank you, Will. So that's a really important point about before you decide what those urgent priorities are, ask the communities that you're working on behalf of and take a user-led or community-led approach. So it's great to hear about your summer surveys, but you're hinting or highlighting some important points there about areas which need to continue, perhaps as a learning point out of the pandemic, and that's perhaps funding digital inclusion projects for people that need a safe space, and allowing for hybrid event facilities so that people have the flexibility to either take part face-to-face or from perhaps a safer space or the comfort of their own home, depending on their accessibility needs. And then also just highlighting perhaps there's a gap for support networks in South Northamptonshire for the LGBTQ community. Thank you. Over to you, Pratima.
Thanks, Rachel. I spoke earlier, obviously, about the NBCT development. So it's both, we're looking for investment in the infrastructure so that we can actually support Black organizations to be the best that they can be in terms of providing services to Black communities. And we know that over the last 10 to 15 years, that lack of infrastructure specifically designed for Black organizations has been lacking. So it's really important that we can kind of invest well, and that through that investment, we know that we can lever in a lot more resource and capacity and energy from communities to do, provide more specific services for Black communities. I just want to give a couple of examples of where we've developed specific services over the last year, really. And they're just very good, two good examples of what we want to do across all the other services. One of the key issues for Black communities is that Black communities haven't had equal access to a lot of services across the piece. So whether you talk about services to older people, people with dementia, people with mental health issues, young people, etc. So the two examples are, we had funding from the DEFRA funding for food provision for Black communities, and through some of the NCF funding as well. So through that, we developed a collaboration of African, Caribbean, and Asian organizations. And through that, over the last 6 months, maybe, we delivered nearly 3,000 food parcels. That service is still ongoing to the African Caribbean communities. And over a year and a half, we delivered 7,500 hot meals for Asian communities. And in bringing that collaboration together, not only did we feel stronger in terms of what we were doing and how we were doing it, but it really built the capacity of organizations to come together, to think together, to work together, to share resources. So one of our partners actually got resources to have a van through DEFRA funding. And of course, that van can be used by other organizations to do that. So in a sense, there are so many added value and outcomes that you can get by collaborating. So you can feel the energy rising, you can feel people able to do more, even though the resources weren't that great overall. So it's a really good example of collaboration. The other one is, which we're just starting off, is teamwork as an organization have actually evidence that they're not reaching Black communities for their counseling services. So they made an application, an external funding application, and received funding for Black counseling services. They've now actually offered that resource to ourselves to develop that Black counseling service. So they know that they don't have the reach of to Black counselors or to people who need that counseling service. And we both share the problem, which is that Black people haven't had access to specific culturally appropriate counseling services. So we've appointed 2 Black counselors, Asian and African Caribbean, and they will work for a whole year to access that service. So those are just 2 really good examples of where we can work together, but we have to create specific provision. Without that, Black communities will continue to have unequal access to critical and urgent and important services in the county. So yeah, so it's investment in both infrastructure and specific services.
Thank you, Pratima. And what you've just highlighted there, I think, is the massive difference in terms of visibility, strength in numbers, resource sharing that happens when you invest in infrastructure. And there's a need to continue that because, as you've clearly stated, there's been a gap in that infrastructure support over the last over a decade and a half, as you've highlighted. And also the important knock-on effect that you talked about in terms of culturally appropriate services, enabling to break through barriers to support vulnerable residents with mental health issues, vulnerable older residents who may be isolated, And then the counter argument to this idea of mainstreaming, I think, which hasn't worked over a period of time. It's an ideal, but until you address the inequalities and recognise the need for specific services, such as you've highlighted through partnership working with teamwork, then we can really reduce inequalities for Black communities within Northamptonshire. So thank you for that. Over to Graham.
Thanks, Rachel. I think there's a number of things that can be done, again, to help reduce the inequalities as far as disabled people and physical activity is concerned, and working almost on a financial sort of scale. So starting with something at very little, if any cost, is just education. And that's always been the case even pre-pandemic, as it is to now, in terms of educating the disabled people and the people most nearest to them, the parents, carers, family members, of what disabled people can do in terms of physical activity. And then obviously working with our providers in terms of making sure that they've got the capabilities to include them in whatever it is in society, whether it's something quite basic, as say out in a park or in an official sports club or in gyms and leisure centres, more built facilities. So no matter what it is they choose to do, they've got the confidence and the ability to do that. So that should come at very little, if any, cost. It's more just a question of empowering these people with that knowledge and the confidence to go along and give it a go. And then, say, our providers to make sure that even if they've got no disabled people in their groups at the moment, that they're prepared should somebody come through the door tomorrow and they can include them. Second bit, I guess, obviously does have some cost element to it, and that's obviously where some disabled people are concerned. They might need some specially adapted equipment to take part in activity the same as everyone else. So think of particularly wheelchair users. There's a lot of need sometimes for sport-specific wheelchairs, for example, for them to play an activity, because we don't want to go damaging their day chairs and make sure that they can't go about their everyday lives with damaged equipment in that respect. So there can be a bit of cost to that. Even things thinking for visually impaired people, if they want to be able to enjoy going out for a jog, a run, which has been so important during the lockdown period, using our green space kind of thing, that if they obviously have got the vision to go and do that safely themselves, there's very simple tethering equipment. That means, again, family member or a qualified run leader can run alongside them and just guide them safely around the course. And then I guess the highest end cost is obviously looking at the infrastructure itself. There again, it's that built facilities to ensure that they meet all the demands of legally, to make sure that the buildings are safe and able to access by disabled people. And then again, just thinking about the outdoor side of things, again, we know how important the green space has been during the lockdown period, when obviously Boris only allowed us the hour out, really down the height of it. A lot of disabled people weren't able to do that. Some were shielding actually, but obviously sometimes it's the infrastructure, whether it's paths, pavements, roads, that allows the rest of us to, again, walk safely or cycle safely. Again, whether they're wide enough to access wheelchairs as well, with the need to socially distance, or again, they're in good enough state that it means they're not damaging themselves more as they go around. So a bit of a sliding scale really, in terms of something, the knowledge, the power, the education. It should be very little, if any, cost. Then obviously the specific equipment a bit more, and then realising it's potentially a bit more of a long-term aim to get the infrastructure in place to make sure that they've got the same opportunities as everyone else.
Thank you, Graham. And so urgent funding priorities here are, first of all, education to empower and raise aspirations for everyone across the ability spectrum about their ideas about the kind of physical activity they can take part in, to build any of their sporting or activity ambitions, and particularly the wider community, parents and carers, to recognise that as well. But having that provision and making sure that there's specially adapted equipment that's purchased and purpose-built facilities, so that sports clubs and activity clubs can take that responsibility to make sure they're accessible for everyone within the community. And then the longer term priority is to physically adapt our geography to make sure that anybody can walk safely or use a wheelchair or continue their life across our green spaces with whatever activities they choose to carry out. So thank you for that. We move on to our next question. So during the COVID-19 pandemic, and we've already touched on this a little bit, the inequalities within our communities and societies have been exposed and have highlighted a huge divide that urgently needs to be addressed. Those most affected by the virus were from our Black and Asian communities, those with disabilities, those living with mental illness, and people living in poverty. We've supported as a community foundation a number of community groups and charities that provided a lifeline to many people experiencing inequalities through our coronavirus response and recovery fund. But I'm sure we could have reached even more groups with even more funds. In the path to recovery from the pandemic, how can the charitable sector, from your perspective, help contribute to reduce inequalities in Northamptonshire? And I think we've already touched on this a little bit around partnership and collaboration. Over to you, Will.
Hi. So I think the first thing is just keep going. Keep doing whatever it is you're doing. Like, we all do amazing work in so many different fields, and the charity sector supports so many people across the county. So whatever your organisation is, whatever you're doing, just keep going, keep doing what you're doing, but do more than that. Like, hope for better, dream big and think big. Like, the funding gets really difficult nowadays, and it's great what Northampton has, like a whole host of ways and support networks for people to get funding. But if you dream big and then talk to these organisations, and see what funding is available, how else can you grow as an organisation to be able to support people? But while you're doing that, really, really important, look after your team, like whether they're paid members of staff, whether they're volunteers, like the core teams behind all charitable organisations. I know our team, we all took some time during the pandemic because things were tough, and things what were affecting our community were also affecting us as individuals. So being there for each other, being able to look after each other, making time for your own team's sort of mental health is really important. As things start to go back to normal, I think the charity sector, because it's close to the ground and working with the people what it's trying to serve, needs to call things out and be prepared to challenge the big people in power, be that government, council, those that are providing services, like sort of schools, workplaces, healthcare. Be prepared to challenge these people and say what you're doing isn't good enough. We're working with a community and you should be doing better for this community. And then in general, we've already touched on this, but I think it's really important what we form partnerships. We can't know everything about everything, but when different organizations form partnerships and work together, it's just so powerful when it's just well, we're helping these people and you're helping these people, and together we can serve both of our communities in a much bigger and a much better way. And then sort of that joint learning, joint sharing of resources and growing and supporting each other can only help all of us do better in the future.
Thank you, Will. So we have there the need for continuation of funding projects that are specifically reducing inequalities within our communities, and ideally more funding where possible. The Community Foundation is always looking for opportunities to bring more funding into Northamptonshire, so we will keep at that. And the important point you made about looking at reducing inequalities within our own charitable organisations as well, so that we're reflecting outwards what we aim to aspire within our communities, and then collectively as community leaders perhaps challenging local authorities, the statutory sector, to step up and help amplify voices of those who have experienced inequalities and discrimination within our communities, so that we can ensure that those public facing organisations improve their services to be accessible to all. And again, the idea of partnership and learning and sharing resources, collaboration over competition. Thank you. Pratima.
Hi, Rachel. As you were summing up, I think it's a really important point, and what Will said as well. I think we need to as a charitable sector, look in before we look out as well. So we should be presenting best practice, best models of employment services and service provision, and that we can demonstrate, and we should demonstrate, equality of provision in employment and services. So I think that there's a, unless you affect the change yourself, you're not going to be able to affect change for others, really. So I think it's really important that we challenge ourselves as a sector. And I think in terms of helping overcoming inequalities, it's really important that we don't lose our core purpose, which is about reducing inequalities in the main. We wouldn't exist or shouldn't exist unless that was a core purpose. So I think there can be a tendency of kind of losing that whole sense of your essence of why you exist and what purpose you're serving. So again, a kind of challenge to us all of ourselves, really. And I think, again, something Will mentioned, which is that, we are there. It is double-edged sword, and we are there to challenge the status quo, and that's not always comfortable. That's not always easy. You are putting yourselves on the line, at risk, perhaps, to your organizations, all of that. So it does come with a price, really, but in a sense, it comes with the territory that we are in that sector, that we have to do that. And I know we would all agree to say we need sustained long-term investment that is, respected fully by the public sector and the health sector in the county, so that we can work more structurally in partnership, and both sectors feel confident about what we're trying to do, as opposed to being at loggerheads really with each other, which sometimes happens. So thanks.
Thank you. So I think some real key points there about long-term investments directed into reduced inequalities, specifically strategic long-term investment. And also, perhaps I'm getting the sense there, although I don't want to put words into your mouth, Fatima, of perhaps a joint sector inequality reduction strategy across the public and charitable sector. Not going back to the old days of the compact, I'm sure you remember those, but something that's a bit more meaningful in terms of a strategic drive. So that's really, really useful. And reiterating Will's points about, if we are to reduce inequalities as the charitable sector, we have to reflect and work within our own organisations to make sure that we're fit for purpose before we take the challenge outwards. And then about that, just a remark and a comment and an acknowledgement, really, that reducing inequalities isn't a warm and fuzzy subject. So it's going to come with challenges. And as you say, anything that rocks the status quo and drives change is sometimes going to be difficult for some. But we should perhaps work in a way that helps people recognise how that journey will be rewarding. Not just within the sector, but our wider communities, and the benefits of reducing inequalities for all. So thank you for that feedback. Graham.
Yeah, no, I think a couple of great answers there. Hard act to follow from those, but again, just continuing that theme really, in terms of obviously the impact and the pandemic's had on disabled people, and as I mentioned at the start, how unfortunately that's led to this growth of the inequality rather than reducing it, as we're starting to see. Having said that, obviously, again, as we are doing now, the sort of the progression of the online both opportunity to meet kind of thing, but from our sector's point of view, it's provided a new way for people to get active, which obviously hadn't been used as much before, and we've actually seen a lot of disabled people have found that very useful, because in some ways it's reduced the barrier of obviously transport to get to places. If they've obviously got an online workout, whether it's live or recorded kind of thing, then they've obviously got the opportunity to do that from whichever space they feel comfortable in their own house, because again, obviously a lot of them have been shielding far more than other groups if they've got long-term health conditions as well, so they've not been able to get out. So that's provided a new and different way for them to do that, which will hopefully carry on going forward when things have improved anyway. Having said that, what that also brings about is obviously a bit of inequalities in terms of who has got and who can afford to have computers and the internet. And again, we've seen that across lots of different other areas of our lives as well, not just in terms of getting active. So great that it's there and great that the opportunities evolved to do that. But as I say, how can all these people access these chances to do that? So that's one element to look at, the IT sort of poverty and the inequality that goes across all sectors, not just disabled people, but low income groups across the board. But then equally, again, it comes back to, in terms of if they're not going to do the online side of things, but they still not feel confident about going out, kind of thing, of, again, that knowledge of what activities they can do in their own homes without the need for the technology. So again, that comes back to the educational side of things, to show people that can do anything, and any little thing can make a difference, whether it's up and down out of a chair, or say if they have got a garden kind of thing, making use of that. And then finally, I guess, again, we do want people to get out, and we do want them to socialise, because that's the beauty of physical activity. It brings so much more than the physical activity element to it in real life. That, again, online you can provide a bit of an online community side of things, but there's no substitute for meeting up with other people in person. And that brings with it not just the physical health benefits, but the mental health benefits that we know are so huge as well, from meeting up, having a chat and a coffee maybe before or after their activities, and then on the way side of things. So wherever possible, we want people to have the confidence to get outside again, start finding out about things that maybe didn't know existed for them in the local community, and then building the physical, mental and social health off the back of that.
Graham, I think you made a really, really important point about the impact that experiencing inequality and discrimination has on somebody's well-being. And again, over the pandemic, through the movement towards a more hybrid online and face-to-face community, it's provided new ways for people on the ability spectrum to get active. So we're talking about investment here in terms of digital inclusion and tackling digital poverty to reduce inequalities, but also recognising not limiting individuals by what they can access, just because of perhaps maybe limited physical movements. It doesn't mean that people still can't take part in physical activity. So perhaps we, as a charitable sector and the wider public sector, have a responsibility to have activity provision that reflects everybody's ability. And then also an important point you made as well about social networks and the offshoot of tackling digital poverty, to allow those perhaps who don't have access or regular access to green spaces and outside provision can still build friendships and networks and get the support they need from the comfort of their home. Thank you, everybody. We now move on to the big question, the big ambition question. As Will said earlier, think big. So it's no mean feat, but so to the panel, what is your vision for Northamptonshire in 2030? What do you hope we can have achieved by then to reduce inequalities for all local residents on our doorstep? Over to you, Will.
This is a bit more of a tough one, really, but I think I'd start by saying if LGBT people were treated properly and that there was unquestionable acceptance across the whole of society. But I think that's a bit further than 2030. So I tried to think of some more achievable things. So there's various things in the LGBT community what really affect people and need to be challenged and called out. So, but if all organisations knew how to support and understand the LGBT community, no matter what their background is, then that means LGBT people can walk into any situation, any setting, and know what that's not going to be challenged or thrown back at them or a reason why they can't access spaces. So But in terms of like, what can we do? What can we achieve? Like, we have various things which keep going up against, up to the government and then being turned down. We as a country are still, our government are still debating whether conversion therapy, like our government have said what it should be scrapped multiple times, and then it goes for survey and then it gets put back to review. Like that should have been scrapped years ago. We have a situation where trans people are not very well legally recognised. We have a system called the Gender Recognition Act, which when it first came around in 2004, I think it was like ahead of its time for most of the world. But now most of the world has overtaken us and has much better ways of recognising the legal gender of trans people. But the UK is dragging its heels and doesn't really want to catch up. There was a recent review and then some law changes, but all the surveys the government did were about 70 to 75% in favour of much bigger changes, but the government like didn't go really far enough. In terms of gender, we can only be legally registered as male or female within the government system, but there is a large amount of the trans community which are non-binary, and they have no legal way of being recognised as such. In terms of us as a local organisation, we would like to get to the point where we have some form of centre. Like, we don't know what that looks like, but we've had a few times where we've rented spaces or been given spaces for like pop-up events which have lasted sort of a weekend or a week, and we found what the community really just benefits from having somewhere where they know they can walk in and they're safe. So that's really of benefit to the community. But we've also found there's another benefit. Well, that's what, if you don't know or you don't understand, but you want to be supportive, having a space where somebody can just walk in and go, I've got a cousin, I've got an auntie, I don't understand this when I heard it on the news. Like, can somebody explain it in a way which is really appropriate so I can understand? Because lots of the general population do want to be supportive of the LGBT community, but they don't always know how to be or how to ask the right questions, and how to be supportive. So there's some of our long-term things, but it's always very, very complicated in terms of like what's achievable, what's realistic, because some of these things are bigger than a county. These are they're like, some things are ingrained in society with how we live at the moment. I'm not sure they're ingrained in history. So, yeah.
Thank you, Will. So I'm going to throw your words back at you about thinking big and dreaming big. I think by 2030, we will aim that all LGBTQ people will have unquestionable acceptance and not merely tolerance. By that time, all organisations across all sectors will have a facility and understanding of how to support LGBTQ individuals within our community. So they feel that there is a safe space for all across the public, private and charitable sector, and will know naturally people's rights and responsibilities to protect those across all of our communities. By that time, we will have inclusive rights, and that means legal recognition for all human beings, regardless of how they identify. And we will have education provision for those wanting to know more about the importance of why we have protective characteristics to reduce inequalities within our communities. And in that sense, as you quite rightfully say, we can think global, but act local. Over to Pratima.
Thanks. I'm probably going to start where Will started as well, which is that that this is incredibly difficult because we are faced with what are kind of structural inequalities generally in the country, and in a sense, just to highlight, given we're talking about inequalities, the issues that arose after the famous football match, and if we think racism is being managed or tackled, it just goes to show how just below the surface it is, and you just need to scratch a little and then, you know, it all comes out. So there was a kind of older black football pundit who had predicted that if the penalties were going to be taken by black footballers, they will face racism, and so it came to pass. And I think we can't forget that that is so real, it's so current, and you know, so the whole sense of Black Lives Matters is not just a phrase, but you know, it's really important that we make that a meaningful outcome really for Northamptonshire. So from the central to the local, you know, for me it is about feeling that there's a very serious attempt at tackling structural inequalities as far as race is concerned, and of course all the others we've discussed today as well. That locally there's a vibrant and a thriving black voluntary and community sector that has gained respect, and where people can do serious business in supporting the most vulnerable people in our communities. That there are kind of measurable reductions in inequalities that we can genuinely, you know, put up and show that we've made that change really collectively. And unless you can measure these things and actually evidence it, you know, how would we know we've done that? So, you know, we've been supporting some very vulnerable people, and one person who actually took his life, and he was receiving a food parcel from the Afro-Caribbean side of the collaboration that we had, and the mental health services did not respond, you know, and you know, the lack of access to mental health services, I think, is an issue for many communities. It's not just for Black communities. And I think I've always believed, and I know my Black colleagues, and Rachel, you'll understand this, that when you start thinking about improving services for Black people, or for the LGBT community or disabled community, you actually start looking at the improvements you will automatically make to the wider communities, you know. Mm-hmm. So I think we need to come at it that way, that we're all in this together, but taking real positive action really will improve services and support for everybody in Northamptonshire. So by way of vision, Black Lives Matter, and tackle structural inequalities, and take some real good local action where you can see tangible change for Black organizations and Black services. Thanks.
Thank you, Fatima. So by 2030, the government will actively be measuring reduced inequalities. We will have a set of indicators by which we can measure journey travelled. And I think that would be something to aspire to, because as you quite rightfully say, we don't know how far we've travelled until we measure the difference and impact made. But some really strong concrete points there about structural inequalities and what is ticking underneath the surface, in terms of racism and racial discrimination as an example, and making sure that there is by 2030 a thriving and vibrant Black charitable sector across Northamptonshire, which has a platform respect and has a big seat at the table to take part in helping challenge the issues that impact on all our communities. But also an important point I think made about mental health services. The NHS has a target of reducing health inequalities, and yet there's clearly structural racism within mental health services, and we know there's gaps and barriers there for a number of communities. So perhaps by 2030 we'll be really pinning down and measuring how we reduce inequalities as a way to truly eliminate all inequalities in the future. Thank you. Over to Graham.
Thank you. I guess to make it 3 in a row in terms of realistic goals and achievements, I think in 9 years' time to say that disabled people are going to be as active as non-disabled people might be a bit too far to push it. But I always like to think about these things in 2 different ways. Obviously, we've got the medical model of disability, where obviously if we think about it in that terms, that 1 in 5, 20% of our population has got a disability. And of those, obviously, as I said there, half as likely to be active as non-disabled people. So that in itself it is obviously a worrying trend at the moment. But having said that, on the positive front, 70% of those that aren't active at the moment said that they'd like to be more. So the want is there from their side of things. Then I guess if we swap it round to the social model of disability, in fact, that it's actually society that's disabling these people. It's the facilities that aren't accessible. It's the providers that haven't got the ability at the moment to include them side of things. So if we look at that from that perspective, I'd like to think the possibility by 2030 to vastly reduce that inequality between disabled and non-disabled people is a realistic outcome. And it's something, as said right at the start, that we have the capability to do right now with education. And then I say with those other things added to it with the financial input into that process, then we can really start to make a huge chunk out of it. I mean, we're very soon out in Tokyo going to see the Paralympics going on, and the capabilities of these superhumans, as it was termed in 2012, what can be achieved by disabled people. But again, talking to a lot of disabled people, sometimes that can be a bit unrealistic for them. They can't necessarily see themselves as these superhumans kind of thing, but we don't want them to see that. We just want them to be active and enjoy all the things that can bring, the same as everybody else in society. So yes, use those as role models and help to inspire and just make a small change kind of thing, but not daunt these people into things that they can't do or they don't think they can do, and that's absolutely fine. So I think with a collaborative attitude across society and a will and a want from everybody, from the disabled people themselves to other members of the public, then I say we can start to really make an actual chunk in that inequality that currently exists.
So Graham, by 2030, Northamptonshire will have the physical resources and equipment and physical space to allow everybody across the ability spectrum to be active and enjoy physical activity in any way that shape or form. And we'll have educational programs to help raise aspirations and make those activities accessible, and to invest in our Paralympian role models, but allow for the fact that most of us are just everyday folk who won't necessarily reach the heady heights of the Olympics or Paralympics, and just allow with human dignity and respect the space for everybody to have the right to be physically active in the way that they see fit and wish to. Wow, you've all been an amazing panel, and I've learned so much and been inspired by your responses, your challenges, and your contributions. And the next action from this particular conversation will be to come up with 4 key actions, like we've done from every community conversation, which we as a community foundation will commit to. This is just the starting point for us. These community conversations will be going out on our social media channels and YouTube to raise awareness and for opportunities for feedback. And we will be revisiting a community conversation around reduced inequalities again. And the next action that you may be interested in is that, based on these wider community conversations, we will be putting together a local UN Charter for Northamptonshire, just as a starting point, and for something to be built on, discussed, challenged, but embraced as we go forward to bring about a 2030 which is sustainable, safer and equal for everyone. So thank you so much, Will, Pratima and Graham, for your thoughts, comments, observations and your contributions today. Much appreciated.